Pat, doctors in Dallas say more than 40 people exposed to the first Ebola patient diagnosed in the United States do not have the disease. And now, as Dale Hurd reports, the CDC has issued tougher guidelines for healthcare workers treating patients with the virus.
The CDC guidelines now call for a full-body suit with a hood that protects healthcare workers' necks. There are also more stringent rules for removal of equipment and the disinfection of hands, and a site manager to supervise the putting on and removal of the protective suit.
The bottom line is that the guidelines didn't work for that hospital. Dallas shows that taking care of Ebola is hard.
Meanwhile, the fiancé of dead Ebola patient Thomas Eric Duncan, Louise Troe, and her family spent their first night out of quarantine after being given the all-clear.
She is thrilled to be free, and yet I think we have to think about what freedom means at this point.
Most of her possessions were destroyed by the decontamination teams. All she has left, her grandmother's Bible, a laptop, and a passport. Still, experts are encouraged that she made it through without getting infected, even though she shared an apartment with Duncan, and they hope it eases fears about Ebola spreading. In Ohio, 142 people were still being monitored for symptoms. 3 people remain under quarantine because they had direct skin contact with one of the 2 nurses infected by Duncan after she visited the state by airliner. And 116 people are still being monitored in Dallas, along with nearly 200 others who traveled on the same plane as infected nurse Amber Vinson. Dale Hurd, CBN News.